Hi everybody. So we're on our final week of asana practice, and this week we'll be doing poses in supine position, so laying on our back. Starting next week, I'll be going into pranayama breathing techniques, followed by some meditation practices. So there's still more to come. This is our last asana week, and I'll also make a video with everything we've learned so far as a complete practice that will take roughly an hour, and I'll post that as well. I did also create a playlist on the YouTube channel that strings together all the asana videos that we've made so far in case you want to practice those in order. So you can just click on the playlist. It's called Asana Practice. I'll link it to our class page as well, and that'll give you an easy way to access all the asana recordings. So this week, asanas in supine position. Again, I'll just know I always mix up supine and prone. So if anybody has a good way to remember that supine is on your back and prone is on your front, please share it with me. So we'll be practicing many different things today. We'll start on our back in a resting position. We'll practice some twists, some leg lifts. We'll be practicing some inversions, shoulder stand, sarvangasana, as well as kind of a forward bend where we, putting our legs overhead in plow pose called halasana. We're doing some twisting to provide a counter stretch to the forward type bending. We'll be doing backward bending in the form of fish pose, matsyasana, and wheel pose, chakrasana. Also, there's a balancing pose, nakasana, boat pose, and the resting poses, one is called pond, tadagasana, and then shavasana is corpse pose. This one you may have heard of. If you attended yoga, you probably have done corpse pose, shavasana. It's oftentimes done at the end of class with the teacher guiding you a little bit, how to let go of your thoughts, how to relax, how to breathe. So I might actually make a separate video about this. I haven't recorded our practice yet, so we'll see. I might put it at the end of this one, but it's definitely something that deserves attention because it's important. And when we do Yoga Nidra later this semester, that's the pose that we do Yoga Nidra, and we're lying on our back, listening to a voice. And also, I was just approved to teach a Yoga Nidra course as well, in addition to this Wellness 101. So you can look out for that one. There's going to be a whole semester of Yoga Nidra relaxation meditations, which we'll talk more about this semester. And also a yoga theory course will be coming up. That's going to be a 3-credit course where I'll talk more about the 8 limbs of yoga, and we'll do some individual projects, and I think it's going to be really interesting. So look out for that one as well. And it does count towards the wellness minor. So some tips for these poses. When we're lifting our legs, you want to keep your legs straight and point your toes to the ceiling. Always relax and breathe normally throughout all the poses. Do not widen your knees in one of the back bends whenever we're doing chakrasana. Make sure that your knees are parallel with your hips. If you let them go wide, it can really strain the outside of your knee. You want to be very careful with that. So if anything, try to sort of push your knees in as you're doing the pose. They're not supposed to be together, but they should be about hips width apart to protect your knee. I had a yoga teacher in India tell me that. He noticed that my knees were going outward to kind of compensate for being able to do that wheel pose. And he very emphatically said you should not let them fall outward because you're going to strain your knee. And he was very right because I had strained my knee doing that I didn't realize what was causing the knee strain, but that solved my problem. Don't bend your knee when you're lifting your leg. Try to keep your leg straight. Try not to overstretch in any of these poses. There's a pose, Pavamuktasana, where we pull our legs in towards the body. Don't strain, don't pull your legs too close, don't pull any muscles, don't overdo it. Matsyasana, fish pose, where we're arching backward. It's very important to take care of your neck in this pose because our neck is arching backwards and hanging back. And so don't strain the muscles in the front of your neck by lifting your head up in that position. When we get out of that position, make sure you lower yourself down to the mat using your elbows. That's important so that you don't hurt yourself. There are a lot of benefits and contraindications to these practices. First of all, poses done on your back can be very relaxing. A lot of these are passive poses that we do while relaxing and breathing. They provide a nice stretch and even some toning to certain muscles depending on which position we're in. It provides some back flexibility. toning the abdomen, as I said, because we're lifting the legs while laying down. A lot of the poses put some pressure on the abdomen, therefore increasing blood flow to the abdomen, increasing digestion, and like toning internal organs, increasing their function. Shoulder stand and plow pose, Sarvangasana and Halasana, they had a whole list of benefits that I wanted to point out. In our supplementary reading, I put all of the photocopies from the books that I'm talking about here, and you can see the pictures of the poses as well. But shoulder stand and plow pose, Sarvangasana and Halasana, are said to improve thyroid function and pituitary gland function, which influences the whole endocrine system. Also, bringing your legs up brings stagnant blood from the lower half of your body to your heart to allow fresh blood to circulate through your whole body. It also brings blood up toward the brain and helps with circulation throughout your whole body. Doing these poses where we're arching our body backwards, bringing the legs up and over our head, we're expanding our whole back, so we're increasing our lung capacity. Thinking back to the pandemic where people were turning patients over onto their back, proning, they were calling it actually, that allowed the lungs to expand more as they were breathing. It's kind of a similar concept where we're flipping our legs over to increase the volume of our lungs, and that helps. It says traditionally it can help with asthma. Also, just that movement helps to release toxins from the lungs and helps our body to remove them. So it can help with respiratory system. And I know at least one yoga practitioner that's a friend of mine was practicing plow pose during the pandemic to kind of like strengthen the respiratory system in the case that he may catch COVID, to try to strengthen his breathing and his lungs. Also, can decrease varicose veins by bringing blood away from the lower half of the body. You'll see these poses. Contraindications. So if you have any spine problems, hip problems, recent abdominal surgery, if you have high blood pressure, if you have any sort of brain disease, as they say in the books, you'll want to pay attention. If you have a hernia or ulcer. Okay, so if you have spinal or hip problems, you should avoid wheel pose, that's Chakrasana. Abdominal surgery, you should avoid Uttan Padasana and Pavamuktasana, that's lifting the leg or pulling the legs into the chest, because that puts pressure on the abdomen. For similar reasons, this pressure on the abdomen, if you're pregnant, you should avoid Pavamuktasana, also Sarvangasana and Halasana, and Matsyasana, because of the pressure on the abdomen. If you have high blood pressure or brain disease, you want to not be causing a lot of blood flow toward the heart and brain. So you want to avoid shoulder stand and plow and fish, which is Sarvangasana, Halasana, and Matsyasana. If you have a hernia or an ulcer, avoid fish pose, Matsyasana, because we'll be stretching that abdomen and you don't want to irritate or aggravate those conditions. I also note here, although I haven't said it leading up to now, but it's important, especially because a lot of these poses you should avoid in pregnancy. Traditionally, it's recommended that during menstruation, you avoid the same poses as you would avoid during pregnancy. They call it your moon week. A lot of people skip yoga altogether during your moon week, but you can also just do gentle poses that don't involve pressure on the abdomen or stretching or twisting unnecessarily. And this is just because those actions can stretch the uterus and the microvasculature and cause more unnecessary bleeding. So traditionally, it's recommended not to do the poses that are recommended to skip when you're pregnant. You would avoid those during your moon week. So I wanted to share that because I had never heard that at yoga classes in the US, and it was like commonly accepted in India to avoid certain poses during that time. And so I have adopted that practice, and personally I think that that's a nice way to do it. So I wanted to share that. Okay, so remember, steady and comfortable positions. I'll pronounce the Sanskrit wrong, so I won't. Slow and controlled movements, and breathe fully. So relax and enjoy. And I'll be posting the asana video soon.